everyone, welcome to the bonus part of our third WCW interview. I'm Mansi and I'm still here with Dr. Mukherjee. We've read that you educate patients and colleagues about domestic violence and also provide support to victims of domestic violence. What led you to be so active in this area, and how do you educate people about these issues?
It's all around you, right? You don't have to look hard. It's if you engage with a person who's wanting to tell you a story and listen to them, it's in front of you. And I've experienced it as a doctor, in my patients, friends, and others who've also experienced it, colleagues. And I've also had colleagues call me about concerns about doctors, male doctors, who are perpetrators as well, and how do you deal with them? Because often these perpetrators don't just flag in one area, they also don't respect boundaries, they're more commonly bullies, and so you do deal with these problems. I think one of the things that I've been really active about is, and particularly I think around when the Royal Commission came up, and also meeting Rosie Batty, who is just a phenomenal human being, is that we need to change medical perceptions of DV from a social problem to a medical problem. If you have a patient come to you complaining of chest pain, you don't sit there going, well, my 15 minutes is up, so I don't really have time to, or cancer, I don't have time to deal with it. And here we are talking about the biggest health burden on women in our society, of which the Indigenous rates are 5 times more. And it's more than diabetes or drugs or alcohol. And, we're sort of saying to them, well, it's a social issue, we don't get involved. I mean, that's absolutely not good enough. So we've been trying to work both as a state committee as well as a college to increase medical literacy around that. So as an academic through the University of Sydney, we've organised different learning modules for DV in already existing learning modules. As the committee, we've updated our position paper. We're starting to present that as conference, and RACS is now working on having a CPD learning module on DV work. And that, leading into something you said just earlier about activism, that was just an area that came out of a clinical problem. About how could I be a better doctor for my patients who were experiencing this. And that sort of really led to change in the college in terms of how we then infiltrate that into a far wider education. It's just a work in progress, but I do think that it's the biggest human rights problem of half the world's population. The more people we have take an active interest in that, the better we're going to be able to deal with it.
How can we, as future health workers, play a role in combating domestic violence?
Firstly, taking an interest, increasing literacy, understanding the health impacts of domestic violence, understanding how the role of the family plays in it, understanding and engaging with the immense amount of research and the institutions that are already working, and how, as health workers, we are a piece in the jigsaw. But also the most strategic piece of the jigsaw, where the industry that the patient is most likely to confide in and present to. And advocate on behalf of the issues that are not being dealt as well by the legal industry, or say that we've engaged with the police force, we've engaged with the government, we've engaged with a whole heap of other stakeholders. Everybody's working in it, but there is a piece of work that we can do better as clinicians to help them do their work better. So, and I think you guys can certainly be a force in that area.
How would you recommend going about being an activist for a cause, whether in the area of domestic violence like yourself, or the global poverty scene, or something like climate change, while pursuing a medical career, especially in the early days of one's career, where time or money might be limiting factors?
I can tell you that time and money are limiting factors in any stage of your career, and just gets worse. If you look at the RAC census stats in terms of hours of work a surgeon will do, usually about 40 to 60 hours is clinical. Everything else is non-clinical. So the reason surgeons work 80 to 100 hours is not because of they're doing paid work, it's because they're doing things that are passionate about them. That's what sort of makes them also effective leaders. It's that it's to be connected to your purpose. It's to be giving to something that is, more than just the clinical work. It's being able to take the problems that you see in the clinic to a platform and advocate and change that, so the health of the community is better. The thing that you develop through this is leadership skills, and that's why surgeons are seen as leadership figures. We don't teach leadership skills in medicine. You won't learn it in a surgical course. You won't learn it going through. It's just something you accrue over time with experience. That part of your experience, there's no time limit on when you can start it. And you can absolutely start it exactly at the very start of your career. You can start it in high school if you like. But that does help you on your CV in getting opportunities throughout your career. More and more, we are starting to credit impact of work that is outside and recognize impact of work that we have as clinicians outside of publication or a grant. And if you're able to, through your advocacy, change policy or have an impact or raise awareness, that is an extremely powerful thing to do. And you're learning through that as much as you're giving through that. And that only helps you more down your career, because you're going to be able to explore more leadership opportunities earlier on than you would have been able to